Test for typhoid fever. For typhoid fever, we will be detecting antibodies, that is IGM antibody or IGG antibody, against Salmonella typhi, that it may be or may not be present within patient's blood or serum. After the blood has been centrifuged, with the help of a plastic pipette that is provided in the box, or with the help of micropipette, we will take out 10 microliter of serum and add into the sample window of the test kit. Immediately after, we'll add 1 drop of buffer solution, and the test kit is allowed to stand for up to 20 minutes. Result will be read within the 20 minutes. Results and interpretation. Interpretation of result. If the test is valid, a colored line will appear at the control region. If there is no color line at the control region, then the test kit is invalid and the test should be repeated once again using a new reagent test kit from the same box or a different box using the same sample. For negative result, only 1 line will appear at the control region. If positive for IgM antibody, then 2 lines will appear, 1 for control and 1 for IgM. If the sample contains or is positive for IgG, then 2 lines will appear again, 1 at control region and 1 at IgG.